Hi.
How is it going?
Good.
Are you feeling well today?
Mm-hmm.
Perfect. Welcome back to the office. It's good to see you as always.
Mm-hmm.
So I have you booked for a dedicated abdominal assessment today. So essentially what that entails is a complete assessment of your abdominal region as well as just kind of the top portion of your pelvis. I will also be checking certain areas of your face, like your lymph nodes, just to kind of rule out any areas that might be inflamed. So give me just a second while I get my gloves on and we'll go ahead and get started. We do have quite a bit to go over today, okay? Are you comfortable?
Yep.
Okay. So you're welcome to just rest and relax. There's not a whole lot that I need you to do. I'll kind of be going over everything and I'll let you know what's going on before we start with everything, okay? Okay, so what I do, just want to make sure that I've got everything updated here so that I can keep up with my notes. I will be notating a couple things as we go on with the exam today. I didn't see that you were having too many kind of adverse symptoms today. You did say that your stomach is upset from time to time and you do have a slight chicken intolerance.
Mm-hmm.
Okay. More so chicken that's commercially produced, you said, though, like fast foods,
Yes.
that kind of thing, but not so much homemade chicken.
Mm-hmm.
Okay. Very interesting. So you are able to eat it. It looks like you just take allergy medication like a Claritin or something and then you're good to go from there.
Yes.
Okay. And are those symptoms that you have with that like hives? Nothing more serious, like you can't breathe or anything like that? Okay, perfect. Okay, well, we can go ahead and get started with the assessment. So I think what I would like to do is begin with just a little bit of a visual inspection. So I'm going to have you just place your hands down at your sides if that's okay. And then I'll just start by having a look at your lymph nodes, which go kind of behind your ears and down below your neck, as well as on your chest. And then I'll move on to kind of having a look at your stomach here, okay? So you're welcome to close your eyes, whatever makes you more comfortable. I don't want to accidentally shine the light in your eyes. And as I'm touching your face, just let me know if any of it becomes uncomfortable for you. Okay, so just gonna start by having a quick look here at your neckline, looking at your nodes. So we have several chains of lymph nodes that run kind of along our jawline. And sometimes we can see just externally whether or not they have become inflamed. So just shining my light in such a way that allows me to see whether or not one side is maybe slightly more swollen than the other, but so far not noticing anything that could indicate that. Also having a look at your neck and chest, having a look at the chest wall, looking for any abnormalities and symmetry there. So I'm going to shine my light down now and see if there's a variation in the shadow on your face, which I'm not noting. Okay. All right, so I'm going to go ahead and begin with some manual palpation. So what I'll be doing is just using my fingers to kind of gently palpate and touch around your face. And you just let me know if any of this is uncomfortable for you, okay? Just feeling for those lymph nodes that I was telling you about that are in this region. Feeling for any possible signs of swelling or inflammation. And lymph nodes are not typically palpable, which means on a general level, when you're feeling well and healthy and you've not had any recent infections, I should not be able to feel your lymph nodes. So I'm not noting any that are palpable today, which is a good sign. Okay, so I'm going to move on to feel the ones that are along your collarbone here. So you have a chain of nodes that run along your clavicle. being sure to feel underneath as well as on top of the collarbone. What I'm going to have you do is just very slightly tilt your head back for me. I'm just going to be feeling here underneath your neck, along your thyroid. Again, feeling for any signs of inflammation. Can I just have you do a gentle swallow for me? Very good. Okay, and you can go ahead and relax. Perfect. So what I'm going to do now is just perform some very gentle percussions of your face. So essentially along the same areas that I palpated, you're just going to feel a gentle tapping of my reflex hammer. Shouldn't cause you any discomfort, okay? Good. And with this, I'm just listening for any difference in sound of auscultation. Anything that could indicate an abnormality from one side or the other. Also looking for any signs of discomfort. So if any of this causes you any pain, then that can be an indication that we might need to look into it a little further. So far, not noting any abnormalities. Good. Okay. So all of that was very good. I didn't note anything that I thought was concerning. So I'm just going to jot that down. Okay, so not noting any abnormalities in your lymph nodes. Inflammatory response appears to be intact. Thyroid also appears to be of normal size and shape. Didn't notice any signs of inflammation there. No swelling among the jawline. And your chest wall was well intact. And of course, no signs of abnormality. Percussion with my hammer. Okay, very good. All right, Isabel, so at this time I am going to go ahead and move on to the abdominal assessment. So you just go ahead and relax. I'm just going to have a look at your belly as well as your pelvis. I might manipulate your clothing just slightly to kind of give me a little bit more of a viewing area. You just let me know if any of it causes you any discomfort, okay? Okay, perfect. So just to start off with, I'm going to go ahead and expose a little bit of a wider area here. So just bringing your top up to about the rib wall so that I can expose your rib cage here and have a better look, and then as well as very slightly pulling down your bottoms so that I can have a look at the umbilical area as well. Perfect, okay. So now that I have good visualization of the area as a whole, I will go ahead and start with my assessment. So I would like to just have a look kind of overall, notating any changes or abnormalities in the skin texture. So skin appears smooth as a whole, not noting any areas that are abnormally bumpy or anything that can indicate an underlying inflammatory condition such as psoriasis or eczema. I see a very small mole here that I will have a look at more closely. As a whole, your skin is very clear. does appear that you had a belly button piercing or an umbilical piercing at one point, so I will have a look at that. So, just pulling the skin slightly taut so that I can have a look underneath, noting any visible veins. Also noting the curvature of your rib cage on both sides, checking for symmetry there. Of course, having a look at the umbilicus here, noting any possible abnormalities externally, but I don't see anything there. So I'm going to go in with a little bit of a different light. So this is just a variation of a pen light, and it's just going to allow me to have a bit of a closer look at your skin. So I'm going to begin by shining it kind of directly here so that I can just have a look at the overall skin integrity. Nothing of note here as far as I can tell. Skin texture is very normal. Everything looks healthy. It does appear that you are slightly cold as I notice some goosebump here, but that's okay. And then just having a little bit of a closer look, excuse me, while I just get slightly closer here. I just want to look at this mole. So it's not raised in texture at all, which is a good sign, and color is normal and consistent with your natural skin tone. So what we like to see with moles is that they're only a couple of shades darker than your natural skin tone. It does become a little bit worrisome if they are black around the edges or darker than what we would like to see. So as far as I'm concerned, this is not anything to worry about here. Like I said, it's not raised away from the skin at all, and while the edges are slightly abnormal, it's nothing that I would say is concerning. It does have a circular kind of oval pattern to it, which is good. So I wouldn't guess that that's anything that we need to worry about. So I'm going to have a little bit of a better look at this belly button piercing, and I did see in your chart that you said this was no longer an active piercing, so at this point we wouldn't really be worried about any signs of infection as it has been closed for some time. I do just want to make sure that there's no signs of abnormal scarring or keloid thickening of the skin, anything like that, which I did not know upon visual inspection. Have a little bit of a closer look here with my brighter light, and not noting anything abnormal here. Also, it does not appear that the piercing is active, meaning that it no longer goes from the opening to the closure. It does appear that the scar tissue has closed it throughout the middle. So if this was a piercing that at any point you wanted to use again, you would likely have to have it re-pierced, okay? All right, so let's go ahead and move on to some palpations of your abdomen. So what I would like to do at this time essentially is similar to what we did with your chest and clavicle area. So I'm just going to push this down a little further and begin by having a look here. So looking for symmetry in your breathing. So when you breathe in, we'd like to see even rise on both sides of the abdomen, which I am noting. So just watching a couple of your respirations, making sure that I'm not noting any abnormality there. And all of that does appear to be within normal limits. So what I'm going to do actually is go ahead and have a listen to your abdomen. So I'm just going to go in with my stethoscope, and it is a little bit cold, I do apologize, but I'm going to place this on various areas here and just have a listen to your stomach. So I'm going to get just a little bit closer here and just kind of gently place this down so that I can hear your abdominal sounds, and listening for normal activity in the colon. Also listening to make sure that your intestines appear to be functioning properly. So we would like to hear some activity in your bowels. Making sure that everything sounds okay and that I'm not hearing any overactive bowel sounds, which could indicate something wrong with your endocrine system, but I'm not noticing that so far. It doesn't appear that you have any underlying diseases such as Crohn's or any other abnormalities with your stomach and your digestive system. This does sound very normal. Then I am just going to place this directly over your belly button. I'm just listening for any signs of umbilical hernia. If there's any more opaque areas that I'm not able to hear, but that does sound normal as well. Very good. Okay. So lastly, I'm just going to flip over to the bell side and have a listen one more time. Good news is that all of that was well within normal limits, so nothing to worry about there. Just gonna go ahead and put my stethoscope back on its holder. And I am just gonna go ahead and notate that your abdominal auscultations were normal. Bowel sounds were active, but within normal limits. I did not note any overactivity. Okay. Alright, so let's go ahead and move on here. And as I stated before, I'm just going to be doing some palpations of this area. So I'm just going to start by palpating around your rib cage here. So I'm just going to first kind of map out this area and just feeling for the protrusion of your ribs here. So this is a very natural kind of line of demarcation that's notable here along your rib cage as well as on this side. I'm just kind of placing my hands in a motion that allows me to go underneath so that I can feel the ribs more easily individually. So I'm just going to be palpating along And this might be slightly uncomfortable, but it shouldn't cause you any pain. Okay, and then being sure to palpate along the edge here. Do that on the other side as well. You're doing great. All of that appears to be normal. I'm not noting any inflammation on either side, and they do appear symmetrical in shape as well as where they end on your abdominal wall here. So the quadrants of your abdomen, they end at right about the same spot, which is what we like to see. So what I'm going to do now is just come a little bit closer here so that I can palpate along your chest wall down to the sternum. So just palpating down this area, putting a little bit of a deeper pressure in between the rib cage. And I'm going to follow that all the way down to your umbilicus. And there's a notable change in texture along your chest wall as we come down. So the further down we come, the more fat deposits you have in your abdomen, which is totally normal. And we just like to see that there is a change in the fatty tissue here versus here. Good. Okay. So I'm going to palpate now coming from the outside, working my way in. Good, and now top to bottom. Good. Perfect, okay. So I'm going to go ahead and palpate directly along your belly button now. And I'm just going to hold the skin slightly taut here and just palpating around in a circular motion, making sure that I'm not noting any further signs of umbilical hernia. All of that does appear to be normal. No notable abnormalities in texture. Alright, Isabel, you're doing really well. So what I'm going to do at this time is proceed with some more percussions of your abdomen. So using the same tool that I used along your chest wall, just going to be percussing essentially the same way, just listening for any abnormalities in sounds with auscultation here. So first, working along the rib cage. There's of course a notable difference in sound in the more bony prominated areas here. So there's more bony prominence, the sound is more kind of hollow, versus when we get to these higher fat concentrated areas, the sound is a little more dense, which is what we like to see. Okay. All of that was well within normal limits. I think what I would like to do at this time is move on to some palpations of your pelvis. So what I'm going to do is, I guess I can leave your pants where they are. I'm just going to bring down this fold. I'm just going to be palpating along the pelvic bone here. So just looking for any abnormalities in the pelvis itself. So your pelvic bone protrudes to the very top portion here, and then as well as the bottom portion of your abdomen. So just making sure that all of that is symmetrical and normal from one side to the other, making sure there's no notable signs of asymmetry, anything that could indicate either a dislocation of your pelvis or maybe just something that would indicate that you would need a realignment, which would be taken care of by a chiropractor. But so far I'm not noticing that. So what I'm going to do now is do just a little shimmy of your pelvis. And this is just going to further allow me to note any signs of dislocation. And all of that was normal. So I'm just feeling right above the bladder and looking for any signs of possible inflammation or enlargement. So looking for any signs of enlargement in the bladder itself, which I'm not noting. It does appear to be normal in size and shape. I'm noting rounded edges, and its placement is kind of midline belly button to pubic area, which is what we would like to see. So now I'm going to move up to palpating your other organs. This is a little bit of a deeper palpation. So all of that was normal, and I do just want to note. Okay. So palpitations are all normal limits, bladder midline to pelvic region. No notable differences with your pelvic bone. Everything appeared to be in place. And percussions of your ribcage were also noted to be normal. Okay. All right, Isabel, you're doing great. So we're going to move on to the next portion of your abdominal assessment, and I do just want to take a couple of very brief measurements for symmetry here. So essentially we're just measuring to see that the distance from certain points on one side are normal in comparison to the other side, okay? So since I have your shirt pulled up pretty pretty equally from one side to the other. I'm going to use this as kind of a base point here. So measuring here. Okay. Comparing that to the other side. Good. And then I'm going to measure the widest point, which we can see is very slightly longer, so about 8.5 inches there. I'm also going to measure the distance from your belly button to your bladder, as well as just the length and width of the belly button itself. Okay, now noting the rise of your abdomen here, I'm going to go ahead and measure from the shallowest point. Good. As well as the width, the widest point here. Perfect. Okay. Good. Okay, so in keeping with the measurements, I'm going to move on to using a different device, and these are called calipers, and essentially I'm going to use this to perform the same thing. I'm just measuring one side to the other. These are very cold. I do apologize. It is a very cold metal, so it might be just a little bit startling here. So I'm going to start midline to kind of the edge of your rib cage here. And then compare that to the other side. Good. I'm going to perform that as well in the lower quadrant, as well on this side. I did notice a very slight difference here, so a slight offset from the center on this side, but it's not any more than about 1/2 inch, which is okay. So again, measuring the distance here. Okay. Perfect. So what I'm going to do now is I'm just going to take this tongue depressor, and essentially it's just a wooden stick that I'll be using to once again assess the texture of your skin as a whole. So what I'm going to do is just use this as a kind of a tool to help me pull the skin, push slightly taut here so that I can have a look at the overall texture of the skin, assessing for any abnormalities in skin texture. So because the wood is so smooth, it will catch on any areas that are not as smooth. So it really just allows me to know anything that I might have missed with my eye. Okay. going to make sure that the mole is in fact not raised. Good. Okay. Okay, so I'm going to go ahead and move on to what will be the last portion of our abdominal assessment, and that is going to be testing for any sensory dysfunction. Now, this is not a test for your ability to sense anything, so you don't have to respond and let me know whether or not you can feel anything. It's more so a test for the neurological response of your sensory component in your abdomen, as well as testing for the abdominal reflex. So I'm just testing for the way that your stomach responds to certain stimuli, essentially, okay? So I want you to just relax for me. I'm going to start with something very simple. And the first tool that I'm going to use here is just a simple sterile sponge, something that's commonly used in surgical procedures. But for the purposes of this exam, I'll be using both sides to produce different stimuli along the skin. And I'm just looking for a normal reaction either in your skin or in the abdominal muscles, okay? So just going to start with the softer sponge side first. I'm going to get just a little bit closer here so that I can note any changes in skin texture. So switching over to a slightly more scratchy side. These are silicone bristles, so they will produce a different sensation. Okay, so some notable changes in skin texture here. I am seeing a very normal kind of flexing response of your abdominal muscles, which is great. That's the response that we are looking for. So I'm going to move on to our next set of sensory components. This time I have two identical items here, and these are just very soft, kind of wispy, feather-like tools here that I'll use to produce a bilateral stimulus on each side. So just relax for me. I'm just looking for a response in one side compared to the other. So starting here. Meeting in the middle and looking for any signs that there's a different reaction comparatively. Course, testing for that natural physical response there. Good. Okay. So I am noticing a variation in your skin texture here, which is what we would like to see. It lets me know that you are reacting normally. Okay. to move on to a different tool, and this one is just a cold metal that I'll be using to gently touch certain areas, and again noting any abnormal responses, okay? Okay. So while I have this tool out, I am going to be using its length to measure the depth of your umbilicus or your belly button. And the purpose of this examination is to measure how far your belly button essentially goes and note any possible abnormalities there. So there is an average length that we like to see in adult females, and that's what I'll be testing, okay? So just going to literally insert this into your belly button and just going to note just want to make sure I get an accurate reading here. So just noting depth here. I will go ahead and measure that, and you are about 3/4 of an inch. Great, so I will go ahead and quickly notate that. Okay, so about 3/4 inch. Perfect, okay. So let's go ahead and proceed with the remainder of the sensory component here. And the next thing I will be testing is your cold response. So this is going to elicit a very specific response in your abdominal wall. It is very cold, so I apologize in advance, but I'll just be running this along the certain quadrants of your stomach, okay? So I'm going to start on this side. Very good flexing noticed here. Here as well. Great, good response there. Perfect, so that was great. You did show a very good response there. And one of the last components I will be testing is your sharp response. So this is a very sharp tool. It won't cause you any pain. It is very distinct, so you will definitely feel it. It's not sharp enough to puncture the skin at all. Even if I apply a variable amount of pressure here, it's not going to cut into my glove or cut into your skin. It just allows me to apply a very specific sensory component to your skin here. So let's see if we can elicit a response. So I'm going to start by very gently coming into contact here. Good. Now I'm going to follow a linear pattern of your abdominal muscles. Good. Perfect, you did great. And the very last portion of your abdominal assessment is going to be another variation of cold response. This time I'm using a tuning fork and just going to be following again the quadrants of your abdominal wall here. So starting at the top left. And lastly, vertically down towards the pelvic region. Good. Okay. And lastly, just testing bone conduction along the pelvic region here. Perfect. Okay. All right, Isabel, well, the good news is we have concluded your abdominal assessment. You did great. I hope you were able to relax a little bit. The good news is that everything looked normal. So there was nothing that I found that was abnormal. All of your measurements were both very symmetrical and bilateral from one side to the other. There were no abnormalities noted in your pelvic region. You have very strong muscle tone in your abdominal wall. I did just want to note that your piercing has closed. So if at any point you would like to get it re-pierced, you would need to have it redone. You could use the same area as there is no notable scar tissue, but it has closed. So I just don't want you to try to stick a piercing in there because it would be painful to you. But other than that, everything was well within normal limits. So I will go ahead and update your chart accordingly, and you are good to go for today, okay? Okay, thank you so much. I'll just go ahead and adjust your shirt for you, and you take as much time as you need, and I will see you at next year's visit.
Okay,
Okay, thank you.